The cover test procedure. Keep the room lights on and if necessary, use localized lighting so that the patient's eyes can be easily seen without shadows. Explain the purpose of the test to the patient. I am now going to find out how well your eyes muscle work together. The following target should be used. For distance cover tests, isolate a single letter of a size one line larger than the patient's VA of the polar eye. For near cover tests, a fixation stick should be used that contain letters or pictures of various sizes. Four, irrespective of whether you are carrying out a cover test during distance or near viewing, you should sit directly in front of the patient at a distance of 25 to 40 centimeters away. This will place you close enough to be able to critically note eye movements. When performing the cover test for distant viewing, you should be very careful not to block the patient's view of the fixation target. For the distance cover test, the patient should have their head erect and eyes in primary position of gaze. For near cover test, the eye should be in a slight downward gaze, similar to the positions for reading. Instruct the patient. I would like you to look at the letter at the end of the room or the letters on the stick. Please keep watching the letters as closely as you can. In a moment, I will place this cover in front of your eyes. If the letter appears to move, please follow it with your eyes and keep it as clear as possible at all times. Before starting the cover test, take the opportunity to observe the fixation stability of the patient's eyes as they view the letter. You can gain a good impression of the stability of their fixation simply by observing their eyes for a period of a few seconds. For example, 5 to 10 seconds, as you remind them to keep looking closely at the letters. Perform the cover or uncover unilateral cover. Test to look for heterotropia. A. Place the cover before the left eye. As you do so, observe the response of the right eye that has not been covered. Repeat this procedure 2 or 3 times before you arrive at any decisions. If the right eye moves when the left is covered, then atropia is present in the right eye. The movement observed occurs to take up fixation. You should allow the eye times to take up fixation, which may be as long as 2 to 3 seconds. If the eye moves out to take up fixations, then in the binocular situation it must have been directed inwards, so an esotropia is present. If the eye is to take up fixation, an exotropia is present. If the eyes move up to take up fixation, then the binocular situation it must have been directed downwards, and so the hypotropia is present. If the eyes move down to take up fixation, hypertropia is present. B. Repeat the cover and uncover test by placing the cover over the right eye and look for heterotropia in the left eye. Once again, repeat the procedure 2 or 3 times. If neither eye moves when the other is covered, there is no heterotropia and you should go to step 8 below. In a unilateral strabismus, when the deviating eye is covered and then uncovered, the non-tropic normal eye will continue to fixate and will not move. If there is a unilateral heterotropia present, there is frequently amblyopia, so that the visual acuity is reduced in that eye. Eyes that strabismus and amblyopia may not take up fixation immediately when the fellow eye is covered. Give them time to fixate and actively encourage them to do so. Note and record any fixation instability or tremor, nystagmus, when the patients attempt to fixate with the eye that normally deviate.